I'm joined by Dr. Neil Shmunis and Dr. Steve Lancaster of the Atlantic Eye Institute. Today we are discussing a new FDA-approved procedure for strengthening the cornea called cornea cross-linking. It's a way to arrest the disease, and this particular disease is called
keratoconus.
Keratoconus. It's something that we don't hear that much about. Thank you both for being here. First of all, explain to the people at home, the viewers, what is keratoconus?
Keratoconus is a non-inflammatory condition of the cornea of the eye, which is the clear window. The condition involves a thinning and a bulging of the cornea, and it starts in childhood, sometimes adolescence, going all the way up to the early teen years. The condition causes a progressive stretching of the cornea, causing an irregular surface and distorts vision. Its incidence is anywhere between 1 in 500 and 1 in 2,000, depending on where it is in the world. It's more common in the climes that are nearer the equator, but it's also associated with eye rubbing and other things that we see in certain climates. The condition can now be arrested or stopped, but the real interesting thing that we found today is we have new measurements of the cornea that are letting us diagnose this condition earlier and earlier. And that goes over to Dr. Lancaster, what he sees with patients.
Okay, doctor, tell us, Dr. Lancaster, what do you see with patients? And I know you also have some graphic that you can show people at home too, to maybe help explain what they're seeing. So tell us, what you see in patients.
Karen, when we do comprehensive eye examinations, we have a lot of different instruments that we use to give us the best mapping skills, mapping of the cornea. Young people that come in with progressive changes in their prescription, progressive and irregular astigmatism may be found, and those are suspects for possibly keratoconus. When you see a bulging or thinning of the cornea, and you can detect this on the corneal mapping, I think we showed it on the screen, and by doing all this thorough testing, you can find out whether a patient may be developing keratoconus.
Okay.
And then we solve it, sometimes by spectacles, sometimes by using contact lenses, which I have in my hand now, specialty contact lenses, but those other patients may be progressing at a rate that can't be corrected or arrested. Those patients may be potential candidates for corneal cross-linking.
Okay. And you also brought along a demonstration model in as well. So
this model just demonstrates that the cornea is the clear window of the eye. Where we look at people's eyes, we have brown, blue, or green. Well, what you're looking through is the clear window of the cornea.
Correct.
And that's the structure that's the whole crux of what's going on here.
I see.
That graphic that you were showing, though, shows the treatment for this condition. And the treatment for this condition is really not surgical. We basically hold the eye open and expose the eye to riboflavin, an FDA-vetted substance now, vitamin B2, and then expose the eye to short wavelength ultraviolet light, as you can see there.
Now, what is that?
That's the corneal cross-links themselves, the corneal collagen fibers, and the little connections between them are the cross-links. And what this does, it strengthens and increases the number of those cross-links to make the cornea more resistant to bulging. As you see, that cornea earlier was bulging up.
So it strengthens
the cornea.
It makes them, I guess, thicker or just stronger?
Doesn't make it thicker, it just makes it stronger.
Okay.
But we really want to stress that in young people who have histories of allergies or problems where they rub their eyes, this condition can be much worse.
Oh, yeah.
And this procedure that we're talking about really has ramifications for the future in older populations. We're really not at liberty to talk about these, but we do laser procedures now that actually are topographically guided on the cornea, and we can make up for irregular spots that heretofore haven't been so. But these patients sometimes are early keratoconus patients, what we call form fruste, and we can identify these people younger, and we can get people better vision and keep people who previously weren't LASIK candidates or maybe not refractive surgery candidates, make them candidates.
Okay, I think that's great, and we only have about 1 minute left. This is FDA approved. Tell us where you guys are located if someone wants to come out and maybe speak to you about this at length.
We have 2 locations, one at the beach on South 3rd Street. We have one off University on Bennett Road. And 2 nice facilities.
When we talk about this in general, because it is such a new technique, how does it present? You said it can get distorted, vision can, but otherwise, how would somebody
That's a great question, Karen. And the reason is because people come in noticing kind of glare, sometimes halos around lights, sometimes kind of a visual static. And as I mentioned earlier, progressive visual changes and changes in their glasses annually that are kind of irregular, more astigmatism. Those are potentially symptoms related to keratoconus.
Okay, there you have it. And I can see the bulging on the one eye, and then that's the normal.
Correct.
Guys, we're out of time. I think you did a fantastic job explaining it, and Maybe I'll come see you.
Okay, come
Thanks
see us,
for having
Karen.
us.
Thank
We'd
you.
love
If
to
not
have
for
you.
this, for something else.
Okay.
Right?
Thank
All
you so
thank
much.
you so much. Thank you, guys.
Bye-bye now.
Bye-bye. Coming up next, Plexiderm, a way to erase years of age off your face. We're going to show you how it works.